We've touched on throughout our conversation. We've touched on technology here and there, and we know that it certainly has makes an important impact. And there's a new piece of technology that comes out seemingly every single day. There's so many different things that are coming out each and every day. I'm curious how advancements in technology are going to influence this conversation, and how technology and workforce solutions can help with this issue, specifically around physician turnover and the cost that it brings. Brian, wanted to start off with you here on your thoughts, what technology brings to the table.
First, I'll say it's interesting because, in the world of healthcare, the demand has always been so high. There's just been a general lack of adoption. I come from a unique place where outside of healthcare, and I've got about 5 years or so experience in healthcare, and I've seen both sides of the coin. So to see the adoption and now the embrace of a lot of technologies is refreshing. So I'll say that. It drives efficiencies, right? It's innovation. There's not like massive sweeping changes to how how health systems are going to market with technologies. In fact, we see a lot of sort of, as Andrew was mentioning, case by case adoption of certain technologies. In particular, the ambient type scribe technologies that we're seeing that are coming in and helping to take away some of that that workload. That's a big piece of it for the providers to, again, to allow them to have the individual patient-facing care that they're so desiring to do. There's other aspect as well, and I'll talk about in general. Master service providers or managed service providers, MSPs, that come in to help manage entire workforce solutions. That's also a really now being heavily embraced within our field to help from an enterprise level system, help really ensure that we've got the right level of visibility on metrics and compliance and things of that nature. So I would say those are probably two of the bigger ones that come to mind when we're talking about technology and the more recent adoption to how we're trying to augment.